Gonna wait just a few minutes to give folks who may be coming off of other meetings or other activities to join. Folks here, I think we can go ahead and get things launched. Welcome everyone to our May Campus Community Engagement Forum. This is a jointly sponsored project of Accords and CCTSI, and saw some of our upcoming events listed on the rotating slides there. Everybody had a chance to take note of those. Today, we're really privileged to again have some folks who are doing amazing work in our Colorado communities. And as you all know, our focus today is on the importance of working with diverse communities in research, and a little bit of historical perspective about that as well. So Kaylee, I think, why don't we just go ahead and start with those introductory slides, and I'll run through those quickly, and then we'll introduce our panelists for today. All right, thanks. So starting off with just a history, there have been lots of examples of researchers causing harm, exploiting disadvantaged populations without benefit, experimenting on people without their knowledge. I think many of us are aware of those, but I think we're still learning about ways in which researchers have either intentionally or unintentionally really caused harm to communities. And that's why it's so important for us to spend time discussing this topic and learning about it. Next slide. So these are some of those examples. The experiments conducted by Nazi physicians in concentration camps during the World War II period, that Willowbrook School for mentally retarded children in New York, the famous Milgram obedience studies conducted in the 1960s, this tea room trade study conducted by a sociology student in St. Louis, research done on the Havasupai tribe in Arizona, and probably the one that's everybody's most familiar with, the infamous Tuskegee study that really limited access to treatment for syphilis in Black men in Alabama. Next slide. So as a result of this, there have been regulations, rules that have been developed around research that basically are based on these three, what we call golden rules. So having respect for persons, the notion of beneficence, which is about doing good and not harm, and then finally this principle of justice or fairness in our research, making sure that everybody has equal access. Next slide. The other thing that I think really comes into play here is studies have shown that race and ethnicity can have great impact on incidence, survival, responses to various pharmaceutical agents, molecular pathways, the epigenetic factors, and uptake of medical and lifestyle interventions. And where we don't do a good job of making sure that we have adequate representation across all of our various racial and ethnic communities, we're really doing folks a disservice in not having them represented in the research. But again, we have, because of these historical abuses, there's a lot to overcome. And we have to acknowledge that, and we have to, this is why it's so important to have authentic partnerships with diverse communities. Willingness to participate, again, is just one factor that can influence decisions about whether or not people participate in research. Some of the other factors listed here, just the simple thing of being informed about research opportunities, their eligibility, and personal circumstances. It's one thing that we're really interested in, is trying to, particularly related to some of our recently funded work with the Community Engagement Alliance Against COVID-19 Disparities, trying to make sure that COVID clinical trials have broad accessibility to diverse communities. Next slide. I think that's it. Yeah. So that's just to kind of kick us off and warm us up. I'm going to next introduce Eric Ashwada. Eric is a faculty member up at Colorado State University and is a member of our Community Engagement Pact Council, the Partnership Academicians and Communities for Translation. Eric has done and is doing amazing work with a variety of communities in Northeast Colorado. And Eric's got a couple of his community partners that have graciously agreed to join us today. And Eric, I'm going to pass the baton to you.
Thanks. Well, I appreciate the invitation, and I also am grateful for all of the attendees who are joining us to help kind of collaboratively wrap our minds around this really important topic. Just for context, I'd say for the last 10 years specifically, I've really had an opportunity to throw myself into community engaged work, working specifically with foreign-born populations in Northern Colorado as they are involved in work and their families as well in agriculture, tourism, and the service sector. And the community that I've been most fortunate to work and have the longest and deepest connections with her is in Fort Morgan, which is a really special place. It's special for a lot of reasons, but the one that stands out to me is that it went from about 20 years ago being predominantly a white rural community to now arguably one of the most diverse municipalities in Colorado. 19% of its residents are foreign born. 36% of the households speak languages other than English. Over 51% of residents identify as Hispanic. And there's also a thriving African immigrant population that is come largely, not exclusively, but largely through refugee resettlement processes out of East Africa to the United States, all kind of attracted towards employment opportunities within industrial agriculture. I think by anybody's measures, I've done the legwork to build these long-term trusting relationships with historically marginalized resident populations within that community. And I would just say that the work has been the blessing of not just my career, but my life, that my life is better because of the partnerships and the friendships that I've made in Fort Morgan and the work that we've done together. But I tell my students that community engaged work or engaged scholarship found me. It's not something that I set out in grad school to build my career around. And it had some negative aspects, like it was a lot of work to figure out how to do things. But the positive part was that I was able to really assess the landscape and look at different approaches and methodologies and figure out what model worked best for me. And as I did that survey, I was looking at CPAR, YPAR, even collective impact models, and I found them wanting. And I couldn't shake the fact that the majority of them seemed to be taking more than they were giving. And that sure, they were including local residents within committees, even within decision-making committees, but at the end, that the final report always seemed to be benefiting the professionals, the researchers, the experts, more than actually addressing the needs of the communities themselves. And to that extent, it felt like we were still replicating those extractive processes of research that have been so heavily criticized, that we go in and we kind of mine these local communities for data that's going to ultimately support our interests, our causes, and even our own careers, and with maybe some benefits to the residents themselves, but never are those benefits fully defined by those residents. And so the thing that is sticking with me today is the ways in which this concept or term co-creation is being used in my professional world. And that I think that the majority of the people that I'm in contact with understand that co-creation is a buzzword, and it indicates something maybe more progressive or innovative or even more responsible than prior models. But when I hear it being used and I see the people, how they are applying their version of co-creation, it seems to be just a synonym for collaboration. And that's really what's missing for me. And I think the key aspect of co-creation is reciprocity. And that really the partners, the community partners that we're working with, the residents from historically underrepresented or historically marginalized communities, they should be defining the ideas themselves. And we should be trying to meet the values and the interests of those communities as much as our own. Now, I've had a front row seat over the last 10 years to see how a variety of different Denver-based foundations, organizations, or research centers have come out to Fort Morgan and worked with community members. I've been culpable for helping to organize countless listening sessions or community assessments or evaluations. And I've seen a wave or a progression of the ways in which these researchers are attempting to reciprocate or attempting to co-create. The first wave, maybe like seven years ago, we'd get these folks that came out, we'd assemble incredible residents from the community, a lot of them coming off of a long shift at the meat plant or at cleaning hotel rooms, their hair's still wet from the shower that they just took to run over to our listening session. And the first wave of reciprocation was the Denver-based folks saying, it was recognition, saying, you're the experts. Thank you so much, you're the experts. And then they'd kind of leave. The second wave, they added food. And so this was maybe like 3 to 6 years ago. They'd say, thank you so much, you're the experts. And now here are some lukewarm tacos to show our appreciation for your expertise. And then I think the current phase that we're seeing right now is gift cards. And so again, thank you. Nobody knows your community better than you. Here are lukewarm tacos, and here's a $20 gift card. And all the while, those people, those researchers, those foundation folks, they're on the clock. They're getting paid whatever, 70 to 150 grand a year. And they're asking these people that they're calling experts to give important information, important data or insights about their community that then the foundation or researchers get to build their careers on, that they turn those into reports, they report out to their supervisors, it kind of goes into their annual performance reviews. They're benefiting in tangible, professional, and monetary ways, all the while just going towards reciprocation in terms of maybe food or maybe gift cards. And so for me, I think the more that I've been able to have relationships with residents, the more conversations I've held that really keyed in on their values and their interests, what I hear from my community partners is what they want. They want power. They want there to be power building. And if I can draw in a concept from my friend and partner, Bruno Sobral, they want ownership of programs. And so the way that I've attempted to enact reciprocation is by building up local power. And no accomplishment in my career, I think, is greater than the ways in which I've been able to support Susanna Gardado and Mahad Dure as they've emerged as, I think, inarguably the most important leaders in their community for that Morgan County and Weld area. And I know something all of you don't know. And what I know is that there's nobody in this state who are better advocates, better leaders, and better organizers of their communities than these two individuals. You don't know it because they're busy working and they are humble to a fault. But for the last year, I've been invited to a number of committees for the governor's office, statewide committees, the PAC committee. It's been great that I've been invited to participate, and all of it trying to figure out how we're going to bring marginalized communities through the crisis of the pandemic as safely as possible. I've participated with one ear as a full, engaged member, trying to figure out how can I contribute to the ongoing conversation. The other ear, though, has been trying to figure out, is there anybody in these rooms that make better decisions than Susanna and Mahad? Is there anybody in the room that put pieces together and organize and advocate better than these two individuals? And I can tell you, there are amazing people throughout the state. They're incredibly effective actors, but I have yet to find anybody who is sharper, more honest, passionate, and effective than these two individuals. And so now I think the best use of time for today would be to maybe hand it over to questions from our attendees, and then allow you folks to kind of absorb the key insights and wisdoms and the true expertise that come out of these incredible community advocates. All right, well, maybe we're shy. So I'm gonna ask the first question then. You folks have worked tirelessly over the last couple of years, last couple of months, that, to be honest, it should have been an absolute disaster in Fort Morgan in terms of COVID. And a year ago at this point, despite what the health district was doing with reporting, and despite the messaging from the leaders in Morgan County of COVID being the concerns of COVID being overblown or whatever, they were shipping in, or they were driving in refrigerated trailer trucks because they were anticipating that the body count in Morgan was going to exceed the capacity of the morgue. Somehow things turned, and I would say that nobody could have expected it's not without tragedy, but nobody could have expected that we got through, especially with the Latino community and the East African community, got through this challenge as healthy as we did. So for Susanna and Mahad, what were the secrets of your success? I know it's been challenging and tough. I know it's been thankless in a lot of ways as well, but it's been a remarkable success. What do you attribute your effectiveness to over the last couple of months?
All right, I'll go first before Susanna. Good afternoon, everyone. Thank you for having me today in this panel. My name is Mahad. Sometimes I go by Mordor. I'm a faculty member at Morgan Community College in Fort Morgan. And I've been working with Professor Ishiwara for the past 3 years as far as community engagement goes. So the coronavirus has mildly affected, I believe, the Somali community in Fort Morgan. What I mean by that is, in the beginning, there's been a lot of confusion about what this thing is. It's a flu, it's not a flu, it's like the flu, it's not like the flu. There wasn't much information on how to confront this pandemic. And there has been a lot of skepticism towards the information that were coming through the main stream channels. And they weren't alone, I would say, in that regard. Um, they were equal to other communities in Colorado that also had their own share of skepticism towards the pandemic. So you could notice that even though we don't have a data, that some people have been affected, they felt flu-type symptoms in the beginning of the pandemic, and they got over it, luckily. But later on, we've implemented this engagement plan in our Sunday class, a class that we have, that we partner with a number of community leaders every Sunday, and I teach them classes as far as nutrition and environmental health and stuff like that goes. So in those classes, we have allocated a specific course for COVID-19, and then we had the opportunity to explain to the community leaders what this pandemic is, how it affects people, their health, and what type of measures do they need to take to prevent themselves, their family, and their community. So it was a 6-week long class. And when we finished that class, or before we finished it, we've seen a tremendous mobilization from the community to confront this, as far as practicing social distancing, wearing masks, washing hands after every time that they go out of their houses. And the results after that were amazing. We almost had, I personally haven't heard of anyone that complained about those flu-type symptoms, what they described as flu-type symptoms at the time, which also mimic maybe some of the symptoms that COVID-19 has. So they not only learned something from that course, but they've also kept that practice of keeping socially distanced, wearing masks, washing hands, consistent throughout the entire year of 2020. And the results have been tremendous. So I am not sure about the number of positive cases. I don't have a specific data to that. I know at least of maybe a couple of deaths, sadly, in Greeley, I believe. I don't know about in Fort Morgan. But also something that I believe that significantly helped the community. I don't know, but it's just a theory that I have, is because um, the majority of the community are of the younger age. So what I mean by younger is below 50, I believe. And that has contributed to maybe, if some of them were affected, maybe to resist the virus. But I think they've been lucky. We've been lucky, and they've been pretty consistent. After we engaged with them, I think it was in April of 2020 that we had that course on COVID-19. The results have been amazing. Things with my community that I know is that rumors can start quickly, as a joke, and then all of a sudden next day it's a fact. So, but as long as we keep that engagement, that constant engagement with the community, and talk to them about what they should do, we pretty much believe in science, and we respect the knowledge of our doctors. a lot of that has to do because of the nature of what we came from, where there was a very poor medical infrastructure, and then coming to America, I mean, people appreciate that the medical abundance that is out there. It's costly sometimes, but for those that are lucky to benefit from it, they don't double think about it. They just take advantage of that. So a variety of things. Maybe one thing is certain, that engagement has helped. It has not only informed the community, but they've also kept consistently practicing those measures. Maybe younger age, um, I would attribute to the success Professor Shuada explained to that.
Awesome. Thank you so much. Susanna, what do you attribute your successes or your effectiveness to?
So everyone, my name is Susana Guardado. I'm the executive director of One Morgan County. We are an organization that works with and for immigrants to create a more cohesive community here in Morgan County, one of the most percentage-wise diverse communities in the States. Probably the biggest thing and the secret to our success was already having these trusting relationships. I had joined the organization in 2017. Already knew a lot of people, obviously, growing up here, coming from an immigrant background, but I strengthened my community connections here within Morgan County throughout the years, where I know like who to tap to and all of that. And then specifically to your question, Eric, having the RXR classes, which are health disparity courses in our given languages. So Mahad teaches the Somali cohort and I teach the Spanish cohort. We already kind of had a platform. We were able to, with some teaching, go to Zoom and again, like tap into these existing community leaders in their given language, talk about COVID. And talk about pandemics and all of that. So I think just the trusting relationships and that information was being presented in their languages and that we were still convening. Like we know convening is really big just within like the Latino community, and finding those spaces to share out and all of that was really important for us. So we were able to demystify a lot of what was COVID. And I knew that our classes were kind of merging into late April and May, which was when those reports of the trailers for the bodies that the morgue was processing were needed. So it wasn't so much as a preventative thing, it was needed. And I really didn't know about it till I seen that report. I drove by and I seen them. I was seeing the obituaries, and you know, it was higher than usual. And I think that like presenting that to folks as kind of our evidence was really impactful. And we're talking about folks who maybe haven't been to a medical facility for like 15, 20 years. A lot of it has to do with like immigration status, really not trusting kind of the medical system per what was given in the introduction with medical studies and all of that. You know, we have a lot of folks who have taken health disparity courses, equity trainings and all of that. And it's kind of presented that syphilis study being the main one, you know, happened. So I think people were kind of going with that, maybe things that had happened in their home countries as well, with not trusting institutions in particular, with experimentation, really not looking out for their folks. Where like we had folks saying, you know, I think I may have COVID, but I don't know. And I think I might get it from going to the hospital or to a clinic and things like that. So we did a lot of demystifying. I think outside of the courses, it was a lot of like one-on-ones, one-on-one discussions. And I think because people trusted me and my co-partner in this, Lilia Vieira, I think that helped quite a bit, and that just kind of like spread out. We had different programs that also, looked at relieving everything that COVID had impacted, in particular with undocumented folks. Like we had a food program, and we were doing weekly check-ins from May on to December with folks where outside of kind of the curation of our items, how the recipe cards were going and all of that, we would ask like, what are your needs? What's going on in your life? And we were able to, push people towards testing, push people towards participating on one of our friends, like feces research and all of that, someone who was trusted in the community and all of that. So again, the basis just being having those trusting relationships, being from the community, tapping into community leaders, and that being in our given language, which for my group was Spanish.
That's great, Susanna. I want to stick with you really quick. So I'm looking at the questions, and so I kind of launched a critique against some of the recruitment strategies, saying like just saying you're experts or providing food or gift cards is not sufficient. In your mind, what's an appropriate way to recruit participants in something like a research study or like a listening session?
Mm-hmm. I think tapping into existing community leaders and those kind of convening points where people are already going, maybe there is someone that they really trust within those convening points. Just kind of the basis.
For specifically Latinas that you work with, what do they find to be like a valuable use of their time?
Yeah.
If we're asking them to participate in a study, what needs to happen for them to walk away thinking that was worthwhile? I felt seen and respected.
Right. I think it's an issue of value. So I think if you communicate the value of their expertise well and not just give a gift card, like you really are the experts to your lived experience. We really, really need your expertise here, and just kind of stressing that, and there being some kind of value placed. We've done everything from just being really transparent with like follow-up in the beginning. I think that there is a survey research overload right now, and a lot of folks don't know what's happening with their information. And I think within like Eric's research and people that we partner with, particularly foundations, we're like really clear, what does follow-up look like with our residents? People want to know what's happening with their statements, with their information and all of that.
I'm just gonna underline that because I think that's so important, and I hear it from the families we work with all the time, is that they want a follow-up. They want to know what happened with the quotes that they give or the information they provided. And the typical pattern has been lots of generosity in the room at the moment, but then once they leave town, we never hear from them again. We never see the report again. There's never any presentation that really shares how that information is being used. And so I think closing that loop and bringing it back to the community is important, and it's underdone. Mahad, same thing. Your community, Somali Muslims, they're famous for being difficult to recruit participation. They're tough to get in a room together. They're tough to get. What do you think is a proper way to acknowledge their participation and recruit them into studies or into activities like this?
I mean, talking to some of my community members the past week, they haven't actually been, I would say maybe 90% of them haven't even heard um, recruiting, the term you've just used about recruiting for statics. I mean, they haven't been invited um, to participate in any of that. I think that given the inherent nature that um, that we view anything that has to do with research, experiment, and all of with skepticism, I think that constant engagement with the community, but not only when they're needed to participate in a study, just to show up and then tell them about, hey, we want you for this, and then take off. I think that constant engagement with them and maybe find a way to connect this research or that particular research to their life and how it benefits them, their children, and to the greater community that they live in is important. Um, so I'd say that the the incentive to incentivize such studies is good, as far as giving them maybe something that signifies appreciations for their participation, like a gift card or anything like that. But I don't think that uh, members of my community would consider that as something, as a drive that would actually bring them to the table and have them take part in that. I think the most important one is that engagement with them, that should be constant, should be regular, checking in, and second, maybe find a way to connect that. What is this, and how is this benefits you, your community, your children, and maybe help somebody down the road, save their lives. I think that's very important. And last but not least, I think that has to come from someone that they trust, that they know who this person is. Um, as you know, Professor Ishawada, is that Somalis value a lot about the interpersonal relationship. I mean, who's this person? How do they know them? And if it's a trustworthy person within the community, the easier it is for them to engage in such studies.
I think that's great and really important. I want to stick with you, Mahad, and I'm looking at Kelly Burns's question. Can you just describe for the typical Somali man that's working at a meat packing plant, came to the U.S. 10 years ago through Kenya, through refugee resettlement processes? What's that typical understanding of, or their relationship to existing health systems, to hospitals, to the Salud or Sunrise Clinic? How do they relate to the American medical system or health system?
So, like I said in my previous statement, is that they're not so much anti-science, anti-medical. I mean, if they get sick, they would go to the hospital and seek help. But one area that I see that is very critical for Somali men especially, is that they don't often focus on preventative medicine. Like, what do I need to do as far as boosting my immune system or my vitamins, or why don't I just go to the hospital and do my annual checkups? They only go to the hospital when they get sick, and when they actually get terribly sick. And a lot of folks I spoke with is that when you ask them about, hey, why don't you just do a general checkup, it's just, they would say things like, well, I don't want you know I don't want to go there because I'm afraid that maybe they would say something big, I have something terrible, but I'm fine the way I am. I am okay. So only if I get terribly sick that I'll go seek help and go to the hospital. So maybe one area for future reference is that you know leaders in that field should focus, is maybe find ways to encourage community members, especially men, a way to have them do those preventative checkups, like screenings, cancer screening, any of those. Find ways to encourage them to do that maybe would be a plus. But that's a typical Somali man, is just that I'd only go to the hospital when I get terribly sick, because I don't want surprises, unnecessary, what they consider as unnecessary surprises.
Susanna, same to you. I know it's tougher because you're the Latino or Latinx community is incredibly diverse. You have multi-generation Mexican Americans, you have newer Mexican immigrants, there are Central Americans, there are Puerto Ricans all within your community. But if you were starting to just provide answers with the families you work with, what are their relationships to the American health system?
I think they vary greatly, just regarding immigration status, and then access to, obviously, then health insurance within the state of Colorado. If you can't provide, social or an ITIN number, it's unlikely that you could get health insurance. So again, we had folks who hadn't been to a doctor in 15 or 20 years versus kind of the refugee experience where or kind of any visa holder where you need like certain vaccinations and doctor visits to take place before or prior, or like, biometrics appointments and all of that. So folks were just really mistrustful, I feel really strong, I feel good, and all of that. And then just the threat of misinformation that I think primarily happened online. I don't know that a lot of folks know that pandemic video and all of that, was in other languages, and it wasn't flagged by Facebook and other platforms till probably a month out from when it was in English platforms. But people were sharing that. They were really attuned to that. I know in my own upbringing, and I was born in Mexico, was able to immigrate fairly easily because my parents were US born just by circumstance, but it wasn't a regular practice to go to the doctor. I would probably go once every 5 or so years. And it was always something that was very kind of nerve-wracking. I didn't see it as something that was kind of benefiting my health and my wellness. And I don't know that my parents really did. Like my dad really became my test subject within everything COVID and vaccine related. And it just came down to kind of orienting my narrative around family. I'm doing this work, and if my own dad doesn't want to get the vaccine, like how that impacts me and all of that. He eventually got it within the meatpacking plant because I was there. After he got it, like he would send his friends over to me. So like my phone has really been nonstop with calls and all of that. Probably not a lot within like some of your networks, but I probably get like 13 or so calls a day with wanting to find a vaccine appointment and all of that. But I think it's, again, that referral, that trusted connection, and tapping into existing trusted spaces and trusted individuals.
Thank you. I want to build off of kind of what we've just established, and I'm looking specifically at Corey Wisner's question as well as Bethany Riggles. They're asking ways of like how to build local power through research, and also how to incorporate more community engagement if it's not part of your grant proposal or your project description. One thing I would share is that specifically within the families we work with in Morgan County, because the majority of them are drawn to low skill or semi-skilled labor, that a majority of those adults have had disrupted educational opportunities, whether it's displacement from civil war and a refugee process, or violence or famine and an immigration process, that a majority of the people, the adults we work with, haven't had an opportunity to get a formal education beyond maybe 3rd grade or 8th grade. And so They're incredibly intelligent. I think you have to be brilliant to be able to really navigate social structures and social systems without that basic K through 12 education that a lot of us take for granted. But there's gaps in understanding there. And so one way of building power, and Mahad's talking about building long-term relationships, is that there needs to be more of an investment in education. And I think building power through knowledge and starting to explain, these are some other ways of thinking about health in holistic ways, or preventative ways, or in systemic ways, but providing access to that knowledge. So when you show up with a study and you're asking for participation, those residents are able to make the best decisions from themselves, from a space of like information and knowledge. And so I think that's one way of building up power, is by empowering these residents with access to knowledge outside of formal education spaces. The other way, I think both Susanna and Mahad were talking about the importance of our entryway into these resident populations depends upon these trusted messengers, or these trusted leaders. And that all throughout Colorado communities, we have a lot of kids of immigrants, kids of refugees who have graduated. Maybe they're 20 years old, they've graduated from high school, they're multilingual, they have cultural competencies, but many of them, due to just a lack of, I think, sufficient guidance or professional development opportunities, that they're underemployed. We have some young women who speak 8 languages. They're fluent in 8 languages, and they're like, yeah, I don't know what I'm going to do with my job. Maybe I'll look into daycare, or maybe I'll look at the meat plant or something like that. Part of building power then in a long-term strategy is finding these really promising emerging leaders and giving them support and professional development opportunities, as well as skill transfer, so that they can have a chance to get professional careers beyond what's right in front of them. And so if you're thinking about your study and you're like, well, we want to do surveys, how can you build in some of these 20-year-olds? Do skill building and incorporate them, so that then at the end, not only are you getting data, but they're walking away with a line on their resume saying that we had an opportunity to do an evaluation, or an opportunity to facilitate small group conversations, or an ability to do lab results. And so I think the thing that I want to emphasize is there's an abundance of talent out there within historically marginalized communities, and they're a bit listless and directionless. And you all have specific needs and skills and resources. And if there's a more intentional way of connecting this talent on the one hand with the needs and skills and resources on the other, building long-term relationships, I think we can start to see transformational change when it comes to representation within your fields, and as well as professional and earning opportunities amongst historically underrepresented populations. Sorry, that was long. But next one, Don, do you have any that you want to raise as we're getting shorter in time?
Yeah, I think Stephen's question about recognition of folks and returning knowledge, I think is a really important one. We often talk about that, we want to leave communities in a better place than they were in when we entered in, or continue to see those kinds of things. I'd be really interested in thoughts about that.
Yeah.
Can I add one quick? Can I add something to that?
Montel, you going?
We had you for a moment and you were echoing.
Okay, sorry, it's mute. Can we also think about how the co-creation issue plays into that? How do we make sure that we are actually authentically working through a co-creative process and moving beyond collaboration? So I think those two are connected. Thanks.
Okay, I'm gonna go with Don's first because that one's easier. Sorry. So if there's a silver lining of COVID, it has been that we've been able to have ongoing, really intense conversations with historically underrepresented residents, asking them specifically, how do you learn about the world? How do you receive information? And what we are hearing time and again is it's through storytelling. And so if our research, if the culmination or the deliverables of our research end up being even just a 10-page report or an 80-page report, the way that we bring it back to community has to be probably in person. Even if it's virtual, they want to see that there is some authorship to it and authenticity to it, and it's probably through storytelling. And as you are telling those stories, you need to find strategies that make it linguistically accessible as well as culturally relevant. And so that means that there is that translation process that's going on. And I think what we found, I'm going to ask Mahad, but I think what we found is that using consecutive interpretation or even that language justice model of simultaneous interpretation with headsets is still a bit off-putting to our residents with limited English proficiencies. And that more, the strategy that's been more effective has been, can we bring somebody in who speaks those primary languages and have them do the full presentation in that language? Mahad, what do you think?
So I agree with you on that, Professor Shuara. And the reason why is because when I talked about the Sunday class, and Susanna explained that as an RX class that I teach to my cohorts, we were very anxious before we begin. We were anticipating that we'll probably have folks in the first few weeks, and then like any other experience in the past, they will not stick around, and then we'll lose those students. So, but what we have discovered to our surprise was that not only we've maintained those students for the past 2 years, but we've had few more come in and join us. And the secret to that is because that the new way of presenting these materials is that we did not bother inviting an expert and simply translating what that expert was saying, but we have learned from those experts, and we created materials that are relevant to our communities, that are culture relevant, and that are actually convenient for them to understand. So, and that came from someone that is one of them, that's a member of their community, that understood their culture, that spoke their language. I think that had a tremendous impact on how they perceive the class, how they receive the knowledge, and also has played an important role in building their confidence, and not only in the instructor, but the materials and the program. If you look at my students today, they are as enthusiastic, as optimistic, as engaged as they've been 3 years ago, and that's amazing. It's not something that I've seen that before. So yes, I agree with you on that, Professor Shuara.
All right, Susanna, what do you think? Especially maybe more on like language justice efforts, where we're seeing increasing use of simultaneous interpretation and headsets. I feel like people employing those strategies, they think like this is the cutting edge, this is the best that can be done. How is that playing out within your community?
Mm-hmm. I think it's a good effort to implement language justice. But you have like a lot of tech issues with the radio feedback and all of that. But I know people are more receptive hearing that in what is called like their heart language, the language that they are able to express themselves in. And I think that they're more likely to tune in. It almost kind of reminds me of school. You know, you're hearing information and you're almost kind of acting that you are kind of absorbing information. So I think when it is done in your language, that folks are extremely more receptive to it. It's culturally tailored, like Mahad said, versus kind of under a kind of white lens or Western lens and all that, where like Mahad and I are able to translate it into not just the language, but into a cultural context. How does this relate into our lives within like immigrant and refugee experience and all that? So yeah, my whole thing here is just partnership with the right folks within communities who are from the given backgrounds.
Awesome, thank you. Before I get to Montel's question, I just want to address this anonymous question from any suggestions for finding groups like One Morgan County and other areas of the state. They exist. And I will also say these two incredible individuals are in some ways underemployed as well, or at least underutilized as well. And so my work is always better by partnering with them or contracting with them. Whatever they say, I just take. Like I never push back. I know that they're always right. And so I'm confident that all of your projects and studies would benefit by reaching out to them as well. And then for Montel, I think the question was, what does co-creation actually look like? Or how do we implement co-creation in like a concrete fashion?
Yeah, how do we move beyond collaboration? And you said that they're often confused.
Yeah, this is so tough, especially for you grant-funded researchers out there, because I know from my personal experience, it's easier, or it's just typically the case that we see an RFP, we apply for funds, and then we get the funds, and it's like, okay, well, now what? Or now how do I build the study out of it? But I do think that co-creation model is, instead of saying, hey, I have this project that I want to bring to your community, can I find partners to work with? It would instead build those long-term relationships with the community, really ask the residents, what do you want? What are your hopes and dreams and your needs? And starting to build research agendas that pay off as much for them as they do for us. And so I think it's a different way. It doesn't really work maybe with the funding structures we're dealing with, and maybe that's something we can talk to like the granting agencies about. But I always know that from my personal experience, the projects that I've built with residents from the start have always worked better and had more like impactful outcomes than the projects where I get a grant and then I try to find community partners to join me in. And so I do just want to emphasize everything we've been talking about today is relationship based and relationship first. And it takes time. And I know that a lot of our like annual evaluation or professional reports don't have ways of accounting for all of that effort, but I do believe that's the responsible way of working with historically marginalized communities.
Thanks, Eric. I want to recognize we're at time. I just want to draw multiple lines under what you just said. I think if you can establish those relationships, find out what folks' priorities are, and then go looking for the grant opportunities that fit those, that actually works so much better than the other way around. I want to thank everyone for your attendance. Thanks especially to Mahad and Susanna for being with us and sharing your valuable time. I think there were, I'm sure, things that we didn't get to. And I think we may think about reprising this down the line if we can. So thanks, everyone.